Welcome to the Pharmacy Podcast Show. You're listening to the first and only podcast dedicated to the business of pharmacy. You can find all of our episodes at pharmacypodcast.com.
This is Dr. Cheryl Lee&nbsp with Azova Health, and you are listening to the Pharmacy Podcast.
Hey, welcome to the Pharmacy Podcast Show. I'm Todd Urey, founder of the Pharmacy Podcast. Excited about today's show because it's something I've been following and I've been trying to keep myself quiet about because I promised Dr. Cheryl Lee I would be quiet about it. Vaxigo. I cannot wait to get into this. Welcome to the Pharmacy Podcast. Dr. Cheryl Lee, how are you?
Great. Good to be here. Thank you.
So we have some other guests I'd like to introduce. Mr. Justin Wilson, PharmD. Justin, welcome to the show.
Thank you, Todd. Glad to be here.
Dr. David Now, you are on the Pharmacy Podcast. This is your first time on a podcast or your second time, or what's going on?
I've done one or two over the years, but excited to be here today.
Excellent. Rannon Ching, PharmD, welcome to the Pharmacy Podcast. How are you?
I'm doing well, thanks. I'm excited to be here as well.
So let's talk about Azova and Vaxigo. I'm going to turn it over to Dr. Cheryl Lee. Give us a groundwork. Tell us about Azova. Tell us a little bit about Vaxigo, but don't give it all away because I have some questions. And then I'm really excited about using the rest of the team to really expand upon this idea, which is making me excited because of the forefront of healthcare that community pharmacy is delivering and becoming much more collaborative. So, Dr. Cheryl Lee, give us an overview.
Sure. So Azova, we started Azova about 3.5 years ago. I am a physician, and I have continually been perplexed at how difficult it is to communicate with the pharmacists that I work with, and really wanted a solution that would enable collaboration and help in care coordination for my patients in working with pharmacists. And I am formerly a clinical research fellow from the NIH and a skin barrier biologist, and developed some skin barrier optimization technology and launched the products about 4 years ago, and we're selling them as compounding bases into compounding pharmacies, and ran into these communication problems with these pharmacies in trying to care for my patients. At the same time, I had patients emailing photos of themselves and their children to my sales team, asking them to ask me to diagnose and treat them over the internet at the same time. And that is where the idea for Azova was born, essentially a cloud of digital health tools that enables any stakeholder to make their business a digital health business that is also connecting or collaborating. So tools for secure record sharing, video calling, secure messaging between physicians, pharmacists, and most importantly, patients as well. We have built out a whole suite of tools for pharmacists to build around their brick and mortar businesses, or just to launch a digital business that enables the pharmacist to generate new revenue based upon clinical services, and especially based upon collaborative clinical care services. And today we're going to focus on Vaxigo, which is our digital vaccination management system. And we are having our national launch this weekend at NCPA.
Wow, that is cool. Justin, you're an independent pharmacy owner. You've been in the business a while. I've followed you through your career as you followed me through mine. I haven't been in the pharmacy industry as long as you have. What does this mean for a pharmacy owner? What does this mean for a clinical pharmacist to be involved with something like Vaxigo?
Well, Todd, it's something I think is the future of our profession. We're getting away from, the paper-based practices. We're trying to find solutions to communicate, as Dr. Eberting said, with other providers, within shared platforms. And I think Azova and Vaxigo has been a real, leap in that direction. I've been excited to be part of it and start using it, on the early stages of it. As far as the Vaxigo product, I was, really looking at ways that we could continue to streamline our travel immunization platform or program. I think we've had a fairly robust one for the last 12 or 13 years. And I thought that, the way we've been doing it is pretty efficient. But since we've been able to work with the Vaxigo folks and streamline that process even further, I think we've been able to take our average travel consult from about 45 minutes per patient down to about 25 minutes per patient. No more paper. We're communicating securely with the patients directly over the platform, able to share records with physicians and other stakeholders as well. So very impressed so far.
Dr. David, now I tell you what, I want to ask you about collaboration. Having a member of your team that has additional tools to really help the patient. Give us your overview of Vaxigo and what it means to be tighter integrated to a pharmacy team.
Well, I think that really the big picture here is that the whole healthcare system's changing and creating more incentives for collaboration between physicians and pharmacists, and also with the payers out there, whether they be an ACO, a health plan, and also hospitals who all have some financial risk around quality metrics, whether it be for diabetes patients achieving A1C, preventing patients from being readmitted to the hospital for medication-related problems, and even for immunizations. And so I think if you're going to play successfully in that space and be able to thrive in this new kind of quality-based payment environment, you got to have the right tools, and you got to be able to work efficiently as well as effectively. And so I think Vaxigo is a very good first step for pharmacists, having a really good module to helping them engage their patients as well as communicate with physicians when necessary, but really helping them efficiently manage that process to boost immunization rates. It's going to be important to the health plans and employers. And so, as we'll talk about later, Vaxigo is really just the tip of the iceberg, but I think it's a great starting point for pharmacists for having the right tools to efficiently manage some of these clinical care services.
Rannon, how does this improve things from collaboration between you as the pharmacist and a physician? How do you see Vaxigo fitting into the paradigm of sometimes complexity? How does this help?
Yeah, that's the beauty of Vaxigo, is that everything is so customizable, but also it's so intuitive, where a pharmacy can really communicate effectively, not only with the patient, but it's really easy to share information with other providers, with doctors, even going back to sharing vaccines given to patients to providers so that they can update their records. It takes, I think, maybe like 2 clicks and typing in someone's username. And so it's really, really great as far as making the process a lot easier so we can focus more on our patients.
Dr. Eberting, I tell you what, I look at the website, vaxigo.com, vaxigo.com, which is easy enough to remember. I'm starting to think of other things, APIs being built to be able to be seamless right into the pharmacy management system, the collection of that data, and then being shared with the electronic health record. So give us a little bit of the technical background of how you see this today and where it could go.
Sure. So Azova, the entire platform, and Vaxigo also, is built to be able to use it standalone if you want to use it standalone, but it also has open APIs. So we can plug in to your pharmacy system, we can plug into your EHR. It is meant to be the middleware that fits in between the EHR and the pharmacy management system and the consumer. At the same time, given the politics around the integrations and the complexity,
that makes sense as a veteran of pharmacy management systems and someone who sold these systems and expecting integration to happen with automation as well as EHRs. It's never easy. So having a middleware piece that plays nicely on both sides of that fence and pulling that fence down for better collaboration between physician and pharmacist makes absolute sense. So talk to us about Vaxigo for influenza, Vaxigo Pro, and Vaxigo Pro on site.
Sure. So Vaxigo for influenza is our introductory product. It enables a pharmacist to offer both a scheduled or a walk-in flu vaccine clinic. So patients can either go to your website or they can walk in and you post just on the wall at your pharmacy. You can get as simple as just posting a piece of paper on your wall at the pharmacy, the web address for the patient to log in and register on their phone. So the patient walks in, enters the web address for your walk-in clinic, signs up as a patient, and fills out all of your forms, payment, provides the insurance information if you want to collect it, and then even consents to the state immunization registries, and then fills out your intake form all electronically on their phone. It takes only a couple of minutes. We have worked tirelessly to streamline the process to make it very, very simple and as fast as possible for the patients. And then they click submit, and that notifies the pharmacist that so-and-so has either scheduled ahead of time or so-and-so has walked in and completed registration for their vaccine. And then from there, the pharmacist, they can either click on their phone and open up the patient's chart and document the vaccine, which, as Rannon said, is literally 2 clicks. It takes just a couple of seconds. The system is all automated, so it's tied to the NDC codes, even the multi-dose vaccines. It will automatically fill all the data fields, the manufacturer fields, all the complex fields that are required for these vaccinations. It's all automated. And then in some states, we've completed our immunization registry integrations. And if you're in one of those states, then the vaccine automatically goes into the queue to be submitted to the immunization registry, and you're done. The system will deploy the vaccine information sheet via email to the patient. It also creates a PDF of the vaccine record for both the pharmacist and the patient, so the patient can print it if they want, you can print it if you want. And then most importantly, it gives the patient a digital and shareable vaccination record that they can share with their schools, their job, their doctor, their other pharmacist, their family or friends. And we also even offer a dashboard that is customized for schools to track and manage their vaccination records.
Great, we'll be right back.
But first, a word from our sponsor.
Independent community pharmacies provide healthcare services to thousands of communities throughout the country and are vital to the good health of millions of people who rely on their neighbourhood independent pharmacy. HD Smith is the only national wholesaler dedicated solely to independent pharmacy and has been since 1954. If you are an independent pharmacy and not partnering with HD Smith for your wholesaling needs, you are likely funding your big box competition. HD Smith's service offerings go beyond traditional wholesale distribution and are designed specifically for community pharmacies. One example is through our PSAO Arete Pharmacy Network. Arete is dedicated to helping community pharmacies navigate reimbursements and help support the financial success of your independent pharmacy. If you are funding your competition, come visit us to learn more at NCPA's annual convention at booth 309. And now back to the Pharmacy Podcast Show.
Been waiting for a collaboration like this between physician and pharmacist for some time, and I'm not even a pharmacist or physician. So a fan of pharmacy and seeing the benefits of this is just not only eye-opening, but it just makes absolute sense. So Dr. David, now the collaboration between you and a pharmacist through some of this secure messaging that's built into the application, talk to us about that. Talk to us about the follow-up and the correspondence and the communication between you and that pharmacist.
Well, I think the key when you're talking about collaboration between physicians and pharmacists is that it'd be easy, right? And be integratable with EHRs and as well as the pharmacy systems. And so it's pretty clear that any physician who wants to be more efficient could be a part of the network. It's very easy to participate. And so I think what we're seeing is going to be happening are these neighborhoods of care wherein Vaxigo can be a great starting point to share vaccine-related information, but the platform on which it sets is scalable and flexible so that you can share chronic care information. The pharmacy's tracking A1C rates for the patient. That could be shared back with the physician as well. Physicians could communicate out to a pharmacist as well, saying, you know, this patient just saw me. I need some follow-up advising them on their diabetes medications. Please work on that. So the flexibility and scalability and ease of use, I think, makes this a very desirable model for how those neighborhoods of care could evolve.
But I want to talk about the dreaded payment models of all of this and how this folds into the world of healthcare. So
when building Azova in the first place, I'm in a state in Utah where we have non-parity laws for telemedicine, for example. Telemedicine is just one of the modules on Azova's platform. And when thinking about, strategically how to design a system that gets around, some states do have parity laws where providers will get paid for doing telemedicine. Some states don't, but patients would be willing to pay for cash for certain services. And then there are also situations where it may be a bundled payment plan where a whole bunch of services from a whole bunch of providers would be included in it. The system takes all of that into account. So if your business model is a cash-based business model, then it's configurable to accommodate that. If your business is an insurance-based business model, it's configurable to accommodate that. If your business is a hybrid, it's configurable to accommodate that. If you work only under value-based programs or even bundled payment models, it's also configurable to accommodate that. The system has a what we call a program or package feature. So if you are offering a bundled payment plan that includes for a total knee replacement, for example, bundled payment plan that includes the medications, the device, the pre-op visit, the surgery, the post-op visit, the physical therapy, and then the pharmacy care all in one price, you can create a bundled program for that patient where the patient can log in and access all of their providers from one dashboard, and the system tracks the patient's utilization and outcome and connects all of the providers to the patient's records simultaneously. And so, as you can imagine, just the logistics of pulling in all of these complexities has been pretty hairy, but we've done it, and it's in a very intuitive way. And it's really exciting to see providers and pharmacists now collaborating and coming up with these really ingenious ways to accomplish what we need to do in this crazy healthcare system we have.
Well, this is David now. Just to share one example of some innovation in the payment models related to immunizations is there's a really neat project happening in the Midwest involving a large payer who's agreed to a pay-for-performance model related to immunizations for pharmacies. So not only can pharmacies be paid their standard fee for administering the vaccine, but if they are able to hit certain targets for the percent of members who were vaccinated not only for flu but also pneumonia, there's a bonus payment from that health plan to the pharmacies for hitting those high targets. So it's putting more money out there to incentivize those top performing pharmacies. And so, you got to, once again, have your tools and structure set up to be able to go after those kinds of bonus opportunities as they crop up, because I think that kind of model is going to spread.
Yeah, and you do this every day. I want to hear from you, Justin, because if I'm listening, I'm a pharmacy owner. I kind of want to hear it from your perspective.
Yeah, I think that's really been the biggest surprise for me as far as the advantage of using the Vaxigo platform is the insurance billing side of it. Most of our travel health patients coming to the pharmacy are brand new patients to our store. We don't have any of their demographic information, their insurance information. We know nothing about them. So being able to have them log into my website, schedule their appointments, fill out all of the intake forms, including their insurance billing, we have a chance before they even get to our store to review everything, go ahead and put in their insurance information to our pharmacy software system, run the claims for the shots that we are going to be recommending to them, and then securely message with the patient exactly what shots we think they should have, what their copays are going to be on each of the shots. So, there's not that sticker shock when they're sitting in your pharmacy that, your insurance doesn't cover anything, you owe $500. Or the flip side, hey, your insurance is great, your copay is $0. We can handle all that in advance. And the patients show up, they know exactly what's happening. They walk in, we do our normal counseling, and we grab an arm and we start shooting. And so it's just really streamlined the process and able to tackle those issues in advance.
Rannon, it sounds like if I wanted to, if I'm a pharmacy owner, I could actually take this on the road into my community, show up at a large employer's HR department, pre-scheduled obviously, and actually do immunizations on site. Talk to me about that opportunity.
Absolutely. That's actually been one of the things that I've found the most, not a creative use of Vaxigo, but it just naturally lends itself to that. So, I mean, Vaxigo makes my offsite flu shot clinics the most user-friendly, simple that you could possibly ever imagine. So in the past, you have a bunch of paper copies everywhere. Some of them are triplicate copies that you have to rip off, give to the patient, have someone try to fax it. And to be honest, from a business standpoint, if that HR you're working with, we did a big clinic for the news station I'm from Austin, Texas. So the big news station in Austin, Texas, and a couple of hotels downtown. And to be honest, those HRs are so busy and they don't have time to worry about this stuff. And Vaxigo makes it so easy. All kind of to piggyback off of what Justin said, I can send a single link customized to that business, has their logo on it. It makes it feel very, very thought out, very efficient. And basically, have the patient fill out their demographics, fill out their intake form. If they're filling out a form for a minor, they can go ahead and log onto the registry and get consent forms, and I can see that as well. And basically, bill all the shots through my pharmacy software before I even show up. And what's nice about it too is if the shot's all covered, then all right, perfect. I have all the information. And let's say if someone typed in the wrong number or I have to get a little bit more information, the secure messaging is a great way to communicate co-pays, any discrepancies in numbers. Maybe someone typed the wrong group number. So to be honest, that's been one of the biggest helps of my life as far as the on-site clinics, because we do a lot of them and it makes it very simple.
This is getting me excited, guys. I'm telling you what, I always want to think of creative ways to get community independently owned pharmacies mobile, getting them outside of their store and going out into their community and generating the reputation that they've always delivered, but at that next generation, that next level of service, showing up at a college campus, showing up at a school district, at the right time when there may be an in-service day to offer these immunizations and flu shots to teachers, showing up at large employers. I mean, this really, and making it easy to do so, showing up with these iPads in my van and a couple technicians and giving out T-shirts and getting people excited about what we can bring to the community as the community pharmacy. So I'm very impressed and excited about this.
Well, thank you, Todd. You mentioned universities. This morning, we deployed the University of Texas at Austin, the on-campus pharmacy, and they essentially immunize all of the faculty and staff, which UT Austin, there are 20,000 of them. And so they will be leading out the way in our university programs. It's very exciting.
Wow. Unbelievable. Incredible. That's a way that this is going to continue to evolve. I want to bring Azova back to talk to us and talk to our listeners more about the telepharmacy side, because there's a big opportunity there. But I want to thank the team for coming on the Pharmacy Podcast show to share the vision of Azova and delivering Vaxigo to the marketplace here at the NCPA 2017 conference. If you are around the conference and you can stop by several of the booths, please do so. But how do we get a hold of the Vaxigo team if we actually wanted to engage you at the conference? Give us a number and or a web address and or an email address or all the above.
Sure. You can learn about Vaxigo at vaxigo.com, vaxigo.com. You can learn about Azova and the additional collaborative clinical care platform technologies at azovahealth.com, AZOVA health.com. And our phone number is 844-MY-AZOVA, AZOVA.
Booth number 434, booth 434. Well, thank you so much, Vaxigo team. Thank you, Justin Wilson, for coming on the show. We're excited about this announcement. And please, like the team has referenced, look into this. This is a big opportunity to expand services that you provide to the community. And it's all packaged for you without you ever having to figure any parts of it out. Vaxigo.com, VAXIGO.com. The link will be down in the show notes. If you're driving, don't look, just listen. And we thank you for listening to the Pharmacy Podcast.